just by way of introduction, I think we're all, as a community of clinicians and charity and industry, really motivated to try to improve active monitoring. I think for patients, certainly for my patients, particularly the first year after diagnosis, the first year of active monitoring can be such a frightening time, such a time with so many complex emotions to work through. So what I'm hoping to do with this talk is to, I think, pitch it at somebody who's perhaps been recently diagnosed with WM, and go through the active monitoring process in some detail. And I think we're hoping all together that over the next few years we can really change the patient experience and improve it. So just by way of introduction, over the next 30 minutes, I hope to give you a sort of a definition of active monitoring and to explain why it's important. On a practical level, I will run through for patients what to expect at your appointment. So really on a practical level, what does active monitoring involve for patients? Importantly, we're going to talk through the advantages of active monitoring. So why is it a good thing, and why is it a good thing to avoid treatment if we don't need it? I hope to give some tips and advice about how to live well in active monitoring, and I think that's what, as clinicians and the charity, we all want to try to help patients achieve, to feel confident, to feel well, to be able to live a really full, happy, healthy life whilst being on active monitoring. And then I'll sum up at the end with some insight into work, which is a collaboration between clinicians, charity, industry, into what we're doing at the moment to try to improve active monitoring. So just to start with a really basic definition, active monitoring is when your healthcare team monitor your WM rather than treating it right away. There are other phrases and terminologies that are used, such as watch and wait, active surveillance, watchful waiting. And I think, generally speaking, most people prefer the term active monitoring. Now, I think the term active monitoring confers a little bit more that this is a conscious decision by your healthcare team to follow this plan, rather than the feeling of it being a doing nothing, or watchful waiting sometimes implies we're waiting for something very negative to happen in the future. It should be a partnership between patients and your healthcare team. We want active monitoring to try to provide patients with a good understanding of WM, a good understanding of what active monitoring involves, because we think that most patients live well on active monitoring if you feel you have a sense of confidence and a sense of control, and you're involved in the process, rather than sometimes feeling like I go to see my consultant, I'm not sure what they're going to say, I'm not sure what the blood tests mean, that sort of feeling of a lack of control, or a worry that suddenly a discussion about treatment might be sprung upon you can really lead to a huge amount of confusion and anxiety and fear. I think active monitoring is associated with really a lot of complex emotions. Often you have the emotions of a new diagnosis of a low-grade lymphoma, and then the discussion around active monitoring, or the discussion around no treatment being required. And that can be really difficult to explain to friends and family, to have a discussion about having a diagnosis of lymphoma but not needing treatment. And sometimes friends might respond in a way, for example, are you sure it doesn't need treatment, or is that definitely right? And I think having the tools to feel confident in yourself about why your lymphoma doesn't need treatment and what triggers there may be in the future for treatment helps give patients that sort of sense of kind of confidence and control, which I think is what we hope as clinicians will help patients to live really well whilst being on active monitoring. It's also really important to know that there's no evidence to show that having treatment earlier has any benefits. And that often goes against what we hear about other types of cancer in the media. There's often, for example, advertising campaigns regarding catching things early and treating things early. And this concept of active monitoring goes against that, and that can be confusing as well. But it is really important to remember that with WM, there's no evidence to show that having treatment earlier has any benefits for patients. So just moving on to think about what is active monitoring practically. For example, for a patient who's coming for their first active monitoring type clinic visit. So active monitoring involves having regular checkups with either your haematology consultant, a clinical nurse specialist, or sometimes another member of your healthcare team. For example, some teams may have specialist pharmacists who are involved in follow-up. And the review is done to make sure that your WM doesn't need treatment. Usually, after diagnosis, most patients are seen probably around once every 3 months initially. And then if we see no change in symptoms or no change in the trend in blood counts, for example, that follow-up can often be stretched out to less frequently, perhaps up to 6 monthly, if there is no sign of any progression of WM. These appointments are coordinated by the hospital outpatient department, so always by a haematology team, not by a GP practice. But they can take different formats, and I think that depends on, for example, patient preference. Sometimes it depends on geography. Sometimes it can depend on even the time of year. So in the department where I work, we do lots of in-person or face-to-face appointments, but I have some patients who live very remotely, for example, in Skye or the north of Scotland, and particularly in the winter time, if they've been well, they might prefer to have a video or a phone appointment. I think it's important for patients just to talk to their clinicians about what type of appointment you feel most comfortable with. Some patients like to travel and been seen in person. I think a lot of the time clinicians also probably feel that we can assess patients most thoroughly in person. Often people ask questions in person that they perhaps don't ask on a video call. But there are other patients who are busy, for whom travelling to the hospital interrupts work or family life. And in that situation, a more remote type appointment might be more appropriate. I always tell my patients it's the same 15, 20-minute slot of time, so you decide what's most useful for you. Sometimes my patients say, I don't want to waste your time, I'll just make it a quick telephone call. But I'd like, to reassure patients that you pick whatever suits you. It's the same sort of time slot. And these appointments are only, maybe every 2, 3, 4 times a year. So make sure that you pick what suits you so that you get out of the appointment what you need. So just basically to run through what happens at an appointment. So first of all, your doctor or nurse will generally ask you an open question. How are you feeling? Often we will then focus on asking you more specific questions which help to guide us in a little bit more detail about WM. So for example, things like tiredness, energy levels, have you had any infections, have you needed any antibiotics from the GP? And we'll often ask about weight loss or sweats. In some situations, we may ask about specific symptoms which relate to some of the complications of WM that we've heard about earlier today. So for example, if we're thinking that a patient might be at risk of hyperviscosity-related symptoms, we'll probably ask about headaches, blurred vision, nosebleeds, and we'll often ask about if you've noticed any lumps or bumps. Again, thinking about an individual patient, if we have a patient who we think may have a neuropathy or does have a neuropathy, we'll then narrow down and ask about questions that are specific to that patient. We will also ask about the vaccinations, and I think there are more and more vaccinations, aren't there? I think my patients are currently having their RSV vaccinations, and then they'll be moving on to their flu and COVID vaccinations. We have shingles vaccines, pneumonia vaccines, so there are so many vaccinations to keep up with. We tend to use a vaccine diary to help our patients with that side of things. We generally have a little bit of a chat about other lifestyle factors. So, for example, any new medical problems, any new medications, and then just thinking about general health, because when we're thinking about the future, patients generally manage treatment best if other medical problems are managed as optimally as possible. And if we also address lifestyle factors, for example, helping patients to stop smoking, helping patients to live a healthy lifestyle. In our younger patients, we may also think about questions that relate to fertility or future family plans. And really importantly, these appointments are a chance for you to ask questions too, and that's a really important part of the consultation. So in terms of examination and things, often if it's a face-to-face appointment, your doctor or your nurse may examine you. In particular, they'll want to check you over to make sure there's no swollen lymph glands, and often to check a gland in your tummy called the spleen. We will usually check your weight and your blood pressure, your observations, and then arrange some blood tests. Most of the time in my clinic, my patients have their blood test done a few days before they come to the clinic in active monitoring, because it gives us the opportunity to talk through the results together. So patients who are on treatment often have blood tests like the day before treatment or the day of treatment, so the results are really up to date. But in active monitoring, often having the blood test done a few days before is beneficial because it gives you the opportunity to talk through your recent results with your consultant. So we'll measure what's called the full blood count. So that tells us about the red blood cells. So it tells us if there's any anemia or not. We look at the platelet count and the white blood cells. And the full blood count tells us how well your bone marrow is working and a little bit about how well your immune system is working. We always monitor kidney and liver function. And then in addition, we measure the IgM paraprotein. So the size of the IgM paraprotein gives us an idea about how much WM there may be there, but probably the trend in the IgM paraprotein is one of the most important things. So pulling all this information together, so a combination of blood tests, clinical examination, and probably most importantly, patients telling us how they feel, allows us to assess and to monitor your WM. So are there any reasons to think about starting treatment? That's one of the questions that's going through our minds when we're in the clinic doing active monitoring. So things that might prompt that in terms of symptoms might be fatigue, sweats, weight loss. When we look at the blood tests, anemia or other low blood counts. In terms of clinical examination, if the spleen is uncomfortable, are there any new swollen lymph glands? We're also looking for problems that relate to the IgM paraprotein. And then we're also thinking about other problems which are less common, but which have been mentioned earlier today, such as neuropathy, skin rashes, amyloid. So we pull this information together at your active monitoring appointments. And often what we're doing is assessing the trend. And that allows us to say to patients, for example, your WM looks stable, the paraprotein is reasonably low level, there are no symptoms or signs to make us think about starting treatment. Or it might make us say, well, your paraprotein has gone up a little bit more than it has in the past. Maybe we'll see you back a little bit sooner this time. So it's often looking at current symptoms and then the trend and then planning together your next appointment. It's important, and what we strive to do is to try to explain these results to you in a way you can understand. And different patients like different levels of understanding and like different levels of information too. So I have some patients who say to me, oh, I don't want to know any of the numbers, just tell me if everything's okay. And then you have other patients who would like to record all the blood counts because that's a good way for them to understand and to cope with things. So I think also letting your medical team know what's the right level of information for you can be really helpful for us too. So next, I thought I would put together a slide to try and give some little tips that I've thought of, or some of my colleagues have thought of, and some of our nurses, to try to help give patients a little bit of a few tips to try to help you get the most out of your appointments. So the first one is really basic. Before your appointment, write down any questions so you don't forget them. Patients often tell me that in the waiting room they had a question in their mind, and then after we started talking, they can't remember it. And then maybe phone back later or get in touch. But it's amazing how quickly something goes out of your mind when someone starts asking you questions. Either take some notes when you're in your consultation if you want to, or ask your doctor or your nurse to write down some information for you. Often patients obviously ask for a copy of blood test results and things. If you feel that you don't want to ask for a printout of blood test results, or it feels like there's not time to write things down in the consultation, then a really quick, easy way to have a record of the consultation is to ask your consultant or your nurse specialist to send you a copy of the letter that's sent to your GP. That means that you have all the information, usually the blood tests and a summary of discussion. That's done as standard in some hospitals and some trusts, and in some areas it's not done, but it's a really quick way to have a record of your consultation. It's often a good idea to take a relative or a friend with you for support, but also to talk through your appointment afterwards. Often 2 pairs of ears are better than one. And we know that probably most people pick up around about a third, or can remember around about a third of a consultation. So having a relative or a friend with you can be a big help. Some of my patients keep an active monitoring diary where they note down, for example, in between appointments, maybe any infections they've had, any trips to see their GP, any new medicines, any vaccinations, so that you have that information really close to hand. You're not having to try to remember it when you're asked about it in the consultation. We all know what hospitals are like. It can be a long time in the waiting room sometime, and that can sometimes bring on feelings of anxiety and stress. So taking a book or something to help you relax in the waiting room so that when you have your consultation, you feel relaxed and you can ask your questions is often also a good idea. Yeah. So what are the advantages of active monitoring? I think the really important sort of take-home message is that active monitoring means that rather than having treatment as soon as we know WM is there, you have treatment at the time that you need it. That means that the full range of treatment options are available when you need them. We've heard over the course of the day about the new treatment options which have become available in the last 5 to 10 years, and where we think and hope that treatment of WM will go in the next 5 to 10 years. So it's important not to have treatment until you need it. Even the more modern treatments, the sort of chemotherapy-free treatments, do have side effects. So avoiding side effects for as long as possible in avoiding treatment is definitely a positive. Patients should be able to live a good quality of life in between these regular outpatient checkups. If you have no side effects from treatment and hopefully minimal symptoms from WM, we hope that active monitoring will help to support that. I think the most difficult time for most patients is the first year of active monitoring. It can be very frightening. There can be a lot of uncertainty and anxiety. And usually I say to my patients, it will get better. You will start to get your confidence to make plans, to travel, to go on holidays, and this will settle in time. And many patients, as we've also heard earlier today, can stay on active monitoring for many years. This is often a difficult question to answer. How long will I stay on active monitoring? For most patients, changes in WM usually happen gradually, rather than when you have a blood test done or you come to the clinic, there being a really unexpected dramatic change. So we let the symptoms that you tell us about and the blood tests that we check in the clinic guide us, and we like to alert patients early if we think there is starting to be a change or starting to be a change in the trend. And that allows us to have an early discussion with patients and clinicians about treatment options. We want to avoid the situation where the patient comes to clinic and we have to talk about treatment for the first time right when it's needed. I think one of the advantages of active monitoring is that we lead into treatment at a point before patients feel unwell, and also when we've had chance over a period of several months perhaps to talk about treatment options, to give patients time to have a think through treatment options, and also to look at what else is going on in life. Are there important holidays, family weddings, work commitments, things like that. So we can try to do things in a controlled, planned way. There is some data looking at active monitoring, and it's always a wee bit tricky to know how helpful this data is. But for example, there was a study published which looked at 48 patients who were on active monitoring. The median follow-up was around 15 years. In that time period of 15 years, 71 patients did progress to need treatment, only 6% in the first year, 39% in 3 years, and 59% at 5 years. I think the data is of some use in terms of giving us a bit of a guide, but I think what's important is the patient as the individual, because there are so many different factors. So how can we help our patients to live well on active monitoring? Our main goals are to help patients to understand WM and to understand the reasons for active monitoring rather than going straight to treatment. We hope that through good consultations, we can help patients to be confident in the monitoring process and to have a sense of control. If patients wish, it's often helpful to be aware of future treatment options. Some of my patients like to talk about, if I needed treatment, what would the options be? And some are not so keen. If it was me, I think I probably would like to have that discussion because it takes away some of the unknowns, and a lot of the anxiety around active monitoring can come from the feeling like there's a lot of unknowns. It's important that we support our patients to know how to report new symptoms or concerns between planned appointments, so you know that if you have anything that you're worried about or you're concerned about, then you know how to be in touch. That can be different in different areas. So, for example, in some areas it may be a direct phone call to a clinical nurse specialist. In other areas it may be that you're asked to see your GP first, who then liaises with the doctor or nurse who's looking after you. And we all know that having access to a clinical nurse specialist is a fantastic resource, particularly around the time of diagnosis. But then it's fantastic to have them at the end of the phone if any advice is needed between appointments. So what can patients do? This is one of the questions lots of patients ask when they come to clinic. What can I do to help the situation? And I think I would reassure most people that no dramatic changes are needed. No strict diets or big change to lifestyle factors are usually needed at all. We would like to support you to genuinely keep yourself healthy, so taking some regular exercise, eating just a nice, healthy, balanced diet, avoiding smoking and avoiding alcohol. I think it's important to remember there's no silly questions, so if you come to the clinic, if you do have a question, then please ask us. It's also really important for us to support all of our patients to access the support that's available, WMUK, the Maggie Centre. Some patients feel like, I'm not having treatment at the moment. I feel I'm coping okay. I don't think I need that. But I try to encourage all my patients to access the support that's there, because even if patients feel like they're coping well, there are always little tips and little extra things we can try to do to hopefully try to make things easier. And I think I'd probably like to reassure patients, particularly in the first year of active monitoring, is it's really hard. There are lots of complex emotions, anxiety, confusion, and I think just take it day to day initially, and it will get easier as time goes on. Often into the second or the third year of active monitoring, I find my patients coping much better. Quality of life is much improved, and anxiety is much better. So just moving on to what can we do as a community of healthcare professionals, patients, charity and industry. So I think we're all keen to improve and also to standardise in some ways active monitoring. So I'd like to say thank you to WMUK and also healthcare professionals who participated in a survey of active monitoring in the UK. I'm sure lots of people in the room completed the survey, so thank you for taking the time to do that. That has prompted us to work on a project to define standards in active monitoring in the UK. And that project will be presented at a WM conference, which will be held in Prague next month. So through this project, we hope to have a published standard in active monitoring, so a standard guideline in active monitoring, which will help to educate and support care across the NHS. Particularly in times when finances are difficult, having a published standard also helps NHS departments in their applications for funding to achieve these standards. So, for example, if a department needs a clinical nurse specialist or other members of staff to try to deliver what's now being defined as a standard, there's far more evidence to support that. So all the work that's been done on this project recently has been excellent in terms of trying to support developments, improvements, and standardisation in active monitoring.
Yeah.
So just to finish up, I thought I would run through the active monitoring checklist, which I'm sure lots of people in the room have seen on the WMUK website. So this checklist has been designed based on the project that's been taken to help patients with their active monitoring appointments. So it's been available to download for a few months now, since April, and there's also an excellent webinar that Charlotte Bloodworth, is one of the lymphoma CNSs in Wales, has done, which has been online for the past sort of 3 or 4 months, which is really worth having a look at. So in terms of the checklist, I have scanned the checklist on, so we'll have a quick look through it in case anyone hasn't seen it. So it's very user-friendly. It gives patients a checklist to go through, just to help guide. So first of all, it starts off with an understanding of active monitoring, the format of appointments, what tests will be done, that I have enough information about what to expect during the active monitoring period. The next section moves on to understanding of WM, so a little bit about symptoms being discussed, what symptoms to look out for, understanding preventing infections, and having been given enough information about condition at this time. So there's a couple more slides on slightly different themes. So this is the theme of additional support, contact details of a CNS, the role of a CNS, information about how to get in contact with charities and for support if needed. And then finally, a little bit about lifestyle and contributing to WM research, if that's something that you're keen on. So this checklist is available to download and to print off. Some patients, I'm sure, will find it really helpful as something either to take to appointments or to go through before appointments and after appointments and make sure that you've covered everything that's important to you. So just to sum up, active monitoring is a conscious decision, and we hope very much it will be a partnership between you and your healthcare team. It's really important to remember that it can be very difficult, confusing and frightening at the start, and that's completely normal, and it will get better. We hope as clinicians to support patients to feel empowered to take a more active role in your care, so for this very much to be a partnership. And then as a community, in terms of future developments, we're in partnership to try to define standards in active monitoring across the UK, and subsequent to that, to aim to improve care.